Hello, I'm honored to recognize the amazing work of the Greater Boston Food Bank and Mass General Brigham in their creation of the Statewide Food Access Report. In Massachusetts, we care for our neighbors and aim to ensure that no one is left not knowing where their next meal is coming from. And together, we will continue to strengthen public nutrition programs, advance food security, and prioritize lived experience to end hunger in our Commonwealth once and for all. So thank you to all the leaders, the researchers, the staff, the volunteers at the Greater Boston Food Bank and Mass General Brigham for standing united against hunger and food insecurity. Thank you for what you do every single day.
Welcome, Team GBFB, directors, advisors, members of the Health and Research Council, and our partners at Mass General Brigham to a preview of the 2025 GBFB Statewide Hunger Study. This will be GBFB's fifth report, which was originally adapted in 2020 with the National Food Access and COVID Research Team, a collaboration of researchers from 15 states who set out to understand the rates of food insecurity during the pandemic. At the time, GBFB was one of only 2 food banks leading on statewide research. Even today, there are very few states conducting their own research, making our report unique. Over the last 5 years, the survey has evolved with input from state, community, and healthcare partners, including our own Health and Research Council. Today, we will hear from our colleague, Dr. Lauren Fiechtner, about the findings of this year's study, and we will hear from Catherine D'Amato about her thoughts on how these findings will impact GBFB's work and potential implications for public policy. During and after Lauren's presentation, we will answer your questions. Please use the chat function, which I will be moderating through this event. The information presented today is embargoed. The public launch will take place tomorrow, June 17th, at the MGH Revere Food Pantry with our partners at MGB, elected officials, and the media. The Boston Globe will also be providing exclusive coverage of the study. In addition, after the public launch, the findings of the study will be shared with agency partners, and if it also will be available, it will also be part of the foundation for a panel discussion at the Bio International Convention on June 18th, the largest biotechnology conference in the world. Please note that we will be recording Lauren's presentation as well. I'm now pleased to introduce Dr. Lauren Fiechtner, Director of Nutrition, Pediatric Gastroenterology, and General Academic Pediatrics at Mass General Brigham for Children, Associate Professor in Pediatrics, Harvard Medical School, and Senior Health and Research Advisor at the Greater Boston Food Bank. Lauren, over to you.
Thank you so much, O'Neill. As O'Neill mentioned, this is the 5th year of the annual statewide survey, and it's really exciting to see all of you, and we're so excited for the event tomorrow. We really have to thank our collaborators, the Department of Elementary and Secondary Education, who got the funding through USDA and have really stewarded this grant and allowed for this research to happen the last 2 years. It's been my honor to serve as a senior health and research advisor at the Greater Boston Food Bank for the past 5 years. It was a very exciting opportunity and really excited to see this amazing work overseeing this statewide survey year over year, which lists the voices of 3,000 people across the state. It's critical to providing data and evidence-based solutions to the hunger relief work we do across Massachusetts. And this year's focus was the cost of hunger in Massachusetts. And so I'll get started into the data. Okay, so here you can see some of the quotes from our research participants. We asked those what would they do if they didn't have to worry about food costs, and you can see what they would do. They would eat healthier and feed their child better. They'd feel less stressed about grocery shopping and meal planning, and freeing up mental and financial resources to focus on other aspects of life. They'd also get to eat all the healthy food needed each day, week, and month, and afford medications and go back to college. And they would be able to afford their bills and afford more household supplies. So from November 2024 to March 2025, and this is the same every year, we launch it right around Thanksgiving. The Greater Boston Food Bank and Mass General Brigham surveyed over 3,000 adults to better understand food insecurity in Massachusetts and its broader impact on nutrition, healthcare, finances, and social connection. This year's goals were to evaluate the cost of food insecurity on dietary quality of adults and children, which impacts health and associated healthcare use, understand the household financial and social strains associated with food insecurity over time, and continue to understand the levels of food insecurity across the state and solutions by residents with lived expertise. This is not done by my team alone. We create a very large coalition each year, and I think we've grown bigger and bigger as more people have been interested in this study. So you can see the incredible richness we have in our Health and Research Council, who provides really in-depth thoughtfulness to the work, and we'll go through kind of the timeline of how we engage all of these folks across the Health and Research Council. We also get input from our WIC offices and the Department of Public Health, those who administer SNAP, DTA, and then also DESE, as I mentioned. We also present to the Massachusetts Food System Caucus, who also helps us figure out which questions matter most to them to improve policies across the state. So this is how it goes each year. After this launch, we will launch right back into this and really think about what are the themes we really want to address next year. We'll have stakeholder meetings with all our coalition, and then we'll begin to develop the survey over the summer. Then we get our research council feedback in the fall, and they help us refine those questions and really make sure how we're asking these questions are going to answer the really pressing needs of the state. We then do programming and testing of the Qualtrics platform. We work with them to really get the 3,000 people across the state, which takes a lot of diligence. And then while we're getting the data, we are actively cleaning it and making sure that these are all valid responses. And so that really is on an amazing piece of work that my data analyst does, and also Qualtrics. And then after we look at all of the data and we analyze it and we look at it with other state representatives across our Health and Research Council and also our coalition. So as I mentioned, the focus this year is really the cost of food insecurity. We know that food insecurity leads to poor nutrition, which then leads to poor health, which then leads to high healthcare basic needs and societal costs. And so this is really a broader impact on than just the individual with food insecurity. In 2024, we estimate a total of 1 million Massachusetts households, more than 1 in 3, experience food insecurity, including 650,000 reporting very low food security, which means a member in their family is skipping meals or not eating for the entire day because there's not enough money for food. This is really a consequence of rising costs and the rollback of key federal support since the onset of the pandemic in 2019. This is the demographics of food insecurity across the state. And you can see here that Black and Hispanic households consistently experience the highest rates of food insecurity, with levels reaching 46% and 62% respectively. LGBTQ plus individuals also have a very high rate of food insecurity at 56%. Seniors, veterans also experience notably higher levels of food insecurity as well. This is our food insecurity by county, and you can see the highest levels of food insecurity by county are experienced in Franklin and Hampshire County, as well as Hampden County, but Suffolk is not very far behind at 49%. You can also see the 4 food banks who work tirelessly to address the needs across the state of those with food insecurity, and we're so glad to partner with all of them on this research year over year. There is also, as I mentioned, a nutrition cost of food insecurity. So for the last 3 years, we've measured nutrition security, which means not just access to food, but access to healthy food. And you can see that over time, nutrition security among those experiencing food insecurity in the state has also risen from 51% to 58%. And then households with food insecurity, we asked them how much more would they need in order to meet their food needs and not be food insecure. And it's really a small amount, just $62 more per week per household to meet their needs. This extrapolated to the 1 million households who are experiencing food insecurity is about $2 billion to solve food insecurity in Massachusetts. We also looked at other financial costs of food insecurity. So it's not isolated that families have to choose just about paying for food. They also have to be able to afford their heat and electricity. And here you can see in the red bars are food insecure households who are struggling to meet basic needs versus those in food secure households in Massachusetts. So here you can see 49% of households with food insecurity were having trouble paying for heat and electricity versus 10% of those with food security. They also struggled to pay for their debts at 48% versus 14% of their food secure counterparts. And housing was starkly different at 47% of those with food insecurity struggling to afford housing versus 4% of those in food secure households. Medical needs, which we'll get into more detail in the future too, is that households with food insecurity were having trouble paying for their medical needs 33% of the time versus 6% in food secure households. So we also asked them how much more would they need to meet all their basic needs, including food, housing, utilities, transportation, childcare, and healthcare. And they said $628 per month. Again, not that much on a family level, but on the state level, that would translate to $7.5 billion at the state. Food insecurity is also associated with chronic conditions. So it often contributes to poor health by restricting access to healthcare and also to good nutrition. It can also increase stress and exacerbate underlying chronic conditions. So these are the most prevalent chronic conditions among adults and children living in food insecure versus food secure households. And here you can see that among adults, the most prevalent condition was mental health condition at 35% among our food insecure households and 19% among those with food security. In children, asthma was the most common, most prevalent condition, with 18% of those children in food insecure households experiencing asthma compared to 10% of those in food secure households. Adapting some of our work with Children's Health Watch that we did a few years ago, we estimated the attributable fraction of emergency room use and inpatient hospital care attributed to food insecurity. So to do this, we asked participants how often they themselves went to the emergency room or were hospitalized, or their oldest child or the child that they worried about the most in their household. And what we did is we estimated that up to 1.3 billion in annual emergency room and hospitalization costs for those food insecure households on Medicaid may be directly related to food insecurity. Also, as I mentioned before, many households have to choose between paying for food and paying for routine medical care. So 40% of adults in food insecure households reported foregoing needed preventive medical care. So 68% foregoed as prescription medication, 39% missed routine medical care because of cost, and 42% missed routine dental care because of the cost. They also noted that 26% of children within their household experienced missing needed routine medical care, including 63% not getting a prescription medication because they couldn't afford it, 53% not getting routine medical care because they couldn't afford it, and 27% not getting dental care because they couldn't afford it. Beyond the medical care costs and the chronic illness costs, there are social costs of hunger that are driven by systemic inequities and really can isolate individuals and limit their ability to engage in civic life in our communities across Massachusetts. So here you can see social participation among food insecure versus food secure households. And those who were food insecure were less likely to attend a place of worship, less likely to volunteer, and way less likely to vote in an election. But there are really amazing solutions, and this is why I have been really honored to be part of the Greater Boston Food Bank team for the last 5 years, is that the charitable and government nutrition programs across the state are incredible. So we did just mention the 4 food banks across the state that provide food to 850 local nonprofit partners, distributing food, including food pantries, mobile markets, and meal programs. And the use of these programs has increased steadily since I started. I actually started right before the pandemic, so this timing is perfect of all this increased need. And I just see the nutrition quality and the quality of all the products we distribute from the warehouse getting better and better, and my patients really enjoying what they're getting at food pantries more and more. So you can see from 2019 to 2024, the increase in overall food pantry use went up from 27% to 48%. But you can also see this increase in 2022 to 2024 when the federal benefits were decreasing from COVID, where people were getting almost every food from almost every month or every other month from a charitable local food assistance program and receiving more than half of their groceries from a charitable local food assistance program. SNAP is also a really key contributor to helping those with food insecurity. It continues to play such a vital role, with 90% of participants reporting the benefits are so easy to use, but 75% still need additional support and often relying on food pantries. So you can see that the enrollment, which has been a really big concerted effort among the state, including now you can share your information with the SNAP enrollment teams when you're signing up for Mass Health or Medicaid. So we've really seen an increase that is very impressive, from 25% of food insecure households being enrolled in SNAP in 2019 to 56%. And we know that all of those aren't eligible, so we also asked the participants' eligibility criteria, and we estimate that 79% of those who are eligible are participating in SNAP, which is an incredible number. WIC and school meals is another really great thing we can talk about in the state and what wonderful things are happening. So you can see over time since 2019 to 2024, the use of school meals has increased rapidly, and we're really lucky to have universal school meals in Massachusetts. So 27% of those with food insecurity were using school meals in 2019, and that's now increased to 73% in 2024. We also saw a really nice increase in WIC use, from 33% of food insecure households using it in 2019 up to 71% of those that we estimate to be eligible. There's also a unique new program that launched in January of 2025, and for which the Greater Boston Food Bank is also participating in as a health-related social needs provider. And this serves Medicaid members with very low food security and certain chronic medical conditions. And families can get 6 months of either medically tailored meals, medically tailored food vouchers, or medically tailored food boxes. And what we estimate is that 19% of those with food insecurity in 2024 who were on Mass Health did receive this service. And so you can see, of those that received the service, 58% had medically tailored meals, 51% received medically tailored food vouchers, and 60% received medically tailored food boxes. So it's possible they are switching between the different kinds of services as well. So in summary, the survey in 2024 really illustrates that food insecurity in Massachusetts is not a temporary crisis. It's persistent and it's a deepening challenge that continues to impact more than 1 in 3 households. The consequences are far-reaching, and the crisis comes with really a staggering cost, not just to the individual, but to the community that we all live in and the state. And really, the reason I'm actually sitting here in the warehouse today at the Greater Boston Food Bank, which I do every Monday as a pediatrician, is that no one sector can do this alone. And so I can only imagine how we can all work together really to solve this. And with this incredible coalition we've created over the past 5 years. So this year's 2025 policy and program recommendations are to really strengthen the public nutrition programs that have been such a lifeline to all the food insecure households across the state this past 5 years, advance food security through healthcare and research, expand access to affordable local produced foods, which we've been doing extensively through the MFAP program, address root causes of economic inequality, and include lived expertise of those living with food insecurity, which I really think this is an amazing platform to do that, because each year we get 3,000 responses and we get very, very rich quotes of what they want and what we can do better. And also to promote social connection and community infrastructure to really address this social isolation food insecurity, food insecure households are experiencing. So with that, I want to thank everyone who is part of this team and send it over to Catherine D'Amato, our CEO, who's going to reflect on what this data means to the food bank and to the state.
Thanks, Lauren. Really helpful. There's a lot of data here, and I know that as we unfold and unpack what we've been learning, there's much more to talk about. But a big thank you to you, Lauren, and to the research team. There's also the entire MGB folks that are behind you that help make this engine go, to our own team and the data folks inside GBFB that work with you, and the agency engagement folks, and lastly to the Health and Research Council for their consistent review, response, iteration that just makes the study better and better over these last 5 years. I also just want to take the moment to share that we want to establish and will be pulling together the continued access to healthy food is an essential part of medicine, and that's why we're launching the Center for Community Health and Nutrition at the Greater Boston Food Bank. It's an initiative designed to deepen our partnership with healthcare providers and tackle that critical link between food insecurity and health, which we know matters significantly, whether it be nutrition, advocacy, access to health insurance, the research, and all of this helps build a healthier future for Massachusetts residents. So the findings this year are clear, yet they're very sobering, that food insecurity in Massachusetts is not a temporary setback. It's a persistent, deepening crisis that affects 1 in 3 households across our state. And since 2019, the overall food insecurity rate has nearly doubled. That's a very significant number to look at what has occurred in the last 6 years. But what is most alarming is the rise in the very low food insecurity. Now, this is another level that USDA measures. This is impacting nearly 1 million households now who are just worried about where their next meal is coming from. But regularly, we find that they're skipping meals or they're going without food for entire days at a time. So the impact of this crisis goes far beyond hunger, and Dr. Fiechtner talked about this in many of the slides. So adults and children facing food insecurity experiences have the higher rates of chronic disease, poor mental health, increased use of healthcare services, all of which come at a significant cost to both themselves, their resources, and communities, and eventually across the state. So the crisis here that we are experiencing, we know, puts people in a lot of impossible choices. Whether do you pay for your food, your rent, your medicine, your utilities, do you save for an emergency? This financial strain only compounds social isolation, but it also erodes community trust. It erodes civic engagement. This crisis carries a staggering economic cost, and this study this year was the focus. Hunger and food insecurity contribute to millions of dollars in healthcare spending annually in Massachusetts, and these costs burden not only families, but they burden employers, health systems, and the broader state economy. So hunger is not only a personal hardship, which we recognize that it is, but it is also a public health and economic emergency. But the data also reminds us that we know what works. And Dr. Fiechtner identified some of those things. And in these times, it's important to grab and own, or at least celebrate what is working and how can we put more effort on that right now. So we know that government nutrition programs like SNAP, WIC, school meals, Medicaid, and MeFAP, that is the state purchasing program that the food banks make food available across the Commonwealth. All of these, along with community food assistance efforts, support what is going to rethink about this as a lifeline, whether you are going into your local food pantry or whether you are going to a meal program or seeking food after school for your child, going to a mobile market. All of these are supported by the 4 food banks across the state. And then we have many, many partners across the state that do the advocacy for SNAP, WIC, school meals, and Medicaid. We know that when these are well funded and accessible, that they reduce hunger, that they improve nutrition, that they support health, they build community, and most importantly, they restore dignity. That progress is reflected in Massachusetts' advancements over the last 5 years. And we are leading by example in our Commonwealth. Yet, however, these sustaining gains still require stable investments and, I would call it, courageous policy leadership. And at this time and this moment that we're in, the courageous policy leadership becomes quite important. As we see cuts to federal programs on the chopping block, some we know about, some are yet to come, that threat will place even greater pressure on families, nonprofits, local economies, our healthcare systems, and many government programs that come into our state that work very well. Now more than ever, addressing food insecurity demands have to be sustained. We have to have coordinated action, and we have to have unwavering commitment to our collective mission. We have individual missions, but when we put them together, that makes our collective output incredibly powerful. The charitable food system cannot do this alone. We must work closely with policymakers to prioritize in legislative agendas and ensure Massachusetts policies and funding remain strong despite these federal threats. And that means championing the research and the data, like the official findings shared today, not undermine it, not forget it, not fund it. This is an unusual study. The data will become very important for us as we go along. But we must also encourage funders who understand the urgent nature of the work and will invest in scalable, evidence-based, community-driven solutions. And lastly, we must strengthen our cross-sector partnerships from healthcare to housing to tackle these root causes together. I'm especially proud of the collaboration that we've built with Massachusetts General and with Lauren's team in recent years. It's an example of how working together produces important information that can drive policy support and sustainability, but also policy changes. So hunger carries a cost that we cannot afford, financially, morally, and socially. It's not merely a symptom of poverty. It is a barrier, a huge barrier to justice, opportunity, and well-being. Yet with smart policy, bold investments, and strong partnerships, Massachusetts can lead the nation in building a future where no one goes hungry. I'm now going to pass it to my colleague, O'Neill Otar.
Thanks, Catherine, and thanks, Lauren, for the great presentation and introduction to the findings of the study. At this time, we will take questions from the participants. I would ask you if you would use your raise your hand icon, and I'll call on you if you'd like to ask the question directly. If not, if you could put it in the chat, and I will read out your question. So I'll take the moderator's prerogative and ask the first question to you, Lauren. Can you speak to why the findings from this study are higher than what we will see from the USDA?
Yeah, O'Neill, that's something we get asked a lot. So the reason we believe this is the case is that this is an online survey where people are much more comfortable sharing information as opposed to sharing with the federal government over a phone call. And so that is very consistent with other research across the country. So there's a national survey that's similar to ours that found rates in 2024 around 27%. And then also the Food Bank of DC also does a report, but only in their service area, not the entire state. And they found the 37% like we do. So that's why we think ours is a bit higher, that we feel people are more honest online with these sensitive questions.
Thanks, Lauren. Given the impact of this study, I'm curious as to why we don't see more studies across the country. You mentioned there are 2 or 3 others. I'm curious as to whether there's a special sauce in Massachusetts that makes this work, or there are other barriers to other jurisdictions doing similar studies.
I think we have such a unique partnership, and when GBFB had a full-time physician on staff before me, so I think GBFB has always recognized this piece of the value of research and data. And so I was so lucky to take this on in 2019. Of course, we had a whole strategic plan for 5 years that I presented to Catherine in February, and then COVID hit in March. And at the time, Carol Tinkin, our chief operating officer, who I was reporting to, asked me, can you figure out how much longer we're going to need to serve this many folks? And so that was really the beginning of the survey. We reached out to the NFAC team, which we knew were starting to do this in 15 states. They have since, I believe, stopped their data collection, but given the Greater Boston Food Bank's leadership and really centering the data and data-driven solutions, that's allowed us to continue this study for the past 5 years, of course, with the help of the USDA funding through DESE.
Thank you for that. Lauren, could you also help us define some terms, food insecurity, nutrition security, hunger? How do you think about those terms? How would you translate them into a layperson who is hearing about these terms for the first time?
Right. So food, it's difficult, but hunger is really the experience that you have of physical symptoms when you're, don't have enough food to eat. And then food insecurity is the experience of being unable to afford enough food or worrying about where one's next meal will come from. And then I believe I said I did define nutrition security during the presentation, but that's basically access to healthy food specifically. So there's definitely an overlap of nutrition security and food insecurity in the measures, which we've done some academic research, further academic publications on that are pending. But it is this unique piece of the healthy foods just to support chronic illness.
And I think you also introduced very low food security as well. Can you define that term?
Yeah, so very low food security is when people are skipping meals or not eating for an entire day because there isn't enough money for food. And so I think there is a lot of confusion of, the overlap of elevated BMI potentially and food insecurity. And really what we see in patients or in families who have food insecurity in this study is that when they don't have enough money to buy food, they actually eat less of both categories, healthy and unhealthy foods, but the healthy foods get lower and lower in their ability to access them. That's why the food banks play such a critical role, and the nutrition policies that our two dietitians really bolster. Rachel Bergen and Laura Ortiz, who really make sure everything we're distributing out of this warehouse is very, very healthy.
Thank you for that. So, Catherine, the burden is, it's been your burden rather to translate these findings to the actions of GBFB as well as in advocacy work with state and federal legislators. I'm curious as to what have you found over the last handful of years that has been most effective in communicating the findings of the study?
It's an excellent question. The legislature cares about this study. I mean, they care about the people of Massachusetts, and they've been very generous through MIFAP funding, which puts food across all of our communities. All 351 cities and towns have access to these state commodities, but they also are very supportive of SNAP, WIC, school meals, and Medicaid. And with school meals, as Dr. Fiechtner noted, we have fully funded school meals in this particular budget for the last few years, and it's showing up. It's showing up in the study. And so I think the partnership with state agencies, whether it's DTA, DPH, DESE, it's MDAR, Massachusetts Department of Agriculture, it's all of these various agencies working together with the nonprofit community. And it isn't just the work of the Greater Boston Food Bank. I mean, our work is important. There's no doubt, but there are so many other organizations that play a role in the advocacy around these federal programs. But what we're able to show in the study is to be able to track year from year the changes that are occurring, positive or negative, by county and by up or down, and then to be able to understand what's moving that needle, both in the federal policy programs that come through, the state's decision around how those are done, and its own resources towards ending hunger, and then the private philanthropic community that comes in and supports all of these nonprofits to be able to take action and cause and effect change. So I think the studies had a really good baseline. I mean, 5 years of data is an important piece. And I think, Dr. Fiechtner could probably stand up an entire research department to just mine this data year after year. So any funders that are interested, step forward. But it's important to have the data. It's important to look at the science. It's important to have consistency. We as advocates are always going to fight for the person who's hungry. But when you're fighting for that, to be able to show a policymaker, city, state, federal, here's what is making a difference, or here's where we lost ground, here's where we gained ground, that has incredible value. And that's the value of the study. It can cause and affect policy changes.
So, Catherine, in the chat, Marcy Sindel writes, a big takeaway here is that more people are receiving food from a charitable food assistance program than the first year of the pandemic. Is that progress? What does that reflect? What does that observation reflect? What does those data tell us?
Well, it's kind of good news and bad news. I mean, the good news is we're able to put more food in the system, and it's healthier food. It's Massachusetts grown products. It's supporting our farmers and ag, and that's through MIFAP, right? And then we have a strong food retail network to handle WIC and SNAP. And many of our farmers and food industry are involved in school meals that make a big difference. So I think what Marcy's asking is legit, because everything became more post-pandemic. I think we all believed we'd go back to normal. And it didn't go back to normal. It iterated and became something else. And what we saw was a rise in food insecurity due to that. So the fact that we have been able to put more food into the system is a reflection of a growth in MIFAP and a growth in that funding to purchase more and put more food into every program across the 351 states in the Commonwealth. So there's more food available. There's hopefully more penetration in terms of achieving impact. But the irony is there's greater need. And so if nothing had changed from 5 years ago and we put the same amount of food into the system today, that would be an interesting study to look at how far would we have come. So I think it's an irony of huge increased need, huge increased response to that need, and everyone doing the best they can to meet the need that comes in front of their doors day after day after day across this state.
Thank you for that. So, Lauren, this data is from 2024, and the big elephant in the room is what will happen as the federal budget takes shape and policy decisions are made around programs like SNAP. Can you speak to what you anticipate the impacts and implications might be for our clients based on what we've heard so far about potential reductions or changes to the programs?
Yeah, what I can say is SNAP really helps families. And I can also say that when we had the increase, there was higher enrollment. So when the SNAP benefit was higher because of the pandemic, there was higher enrollment and lower food, at least stable food insecurity rates. And so I think we'll expect that more people will be coming to the food pantries because there will be less SNAP benefits in the system. So that's what I can tell you with my crystal ball.
Catherine, your perspective?
Yeah, and I mean, we know there's going to be an impact. We know what the House version of the bill is, and we have seen as advocates the Senate Ag Committee's release. So we have an indication of direction around SNAP in particular. And there will be less resources, there will be more regulatory requirements on families and individuals to meet in order to receive the benefit. Where it puts pressure, whether it be SNAP, WIC, and then Medicaid is a very big issue for all states in terms of families losing their health care, because it's one of the trades, right? Do I pay for my health care or do I pay for my food? Well, what do I do? So if you don't have that health care, then they're going to either go without health care, or some families are going to have to, it's just a very big problem for us. So in such, there will be greater demand, we believe, on the private pantry system. And that's why, again, MFAP becomes so important for the growth that we hope will come out of the State Conference Committee in the next couple of weeks, is to see additional resources allocated in order to put that food in the system across the state, where families are going to have a serious problem around making trade-offs. Now, these programs like Medicaid, SNAP, WIC, they're federal programs, so it's not like you pick up and go to another state and get a better deal. The deal's the same in every state. So all states are going to be impacted with this. And I think that we can be assured that we're going to have a higher demand. I think we can be reassured there will be changes in federal policy. I think we can be, hopefully buoyed up that we have a state that thinks about these things and is giving really intentional thought to how they're going to address these kinds of cuts in a state budget in order to not lose ground and maintain everything else in a state budget that they have been committed to, relative to keep things moving. Because there's so many factors that come and play in people's capability to stay out of food, to stay food secure and to not lose ground on their food security. So housing, employment, education, healthcare, it's all there, access to food being the major one. So I think that we're all trying to brace ourselves, and that, as was noted, and lastly, private philanthropy will step forward and I think try to help, but it cannot make up that kind of a major billions and billions of dollars of less resources coming into a state. So Our state has their hands full in prioritization, and I think we have our hands full as advocates of what we're fighting for, and lastly, as service providers in doing the best we can with the resources we have day after day.
Thanks, Catherine. Lauren, I wonder if we could drill down a little bit on two findings or two areas of focus in the study. The first was the impact of food insecurity on healthcare costs, and previewing a little bit the bio panel on the impact of food insecurity on chronic medical conditions. Can you speak a little bit about that, about the impact on chronic medical conditions, what you have observed, and thoughts on what that means for state policy?
Yeah, I think there are some really amazing, hopeful things like the HRSN piece that we talked about, the health-related social needs, which I'm so happy that the food bank has 2 contracts with 2 Mass Health ACOs doing this work, which is incredible. And so I think that's how we can address this. But what we basically did is looked at the reported chronic conditions among those with households with food insecurity, households without, and we also asked them to report on any adult in their household, and then also the child they were either most worried about their health or their eldest child. And so that slide showed the very prevalent conditions that these households are experiencing. On my end, of course, as a pediatrician, seeing the higher level rates of asthma is important for us to know as pediatric providers, and then also autism and developmental delays. Those families have so much on their plates already with addressing all their children's needs. And so to think that they also need to think about where their next meal is coming from is pretty heartbreaking. So I'm hoping that investments in the state to keep health-related social needs service providers available will be really crucial. In fact, I'm doing an obesity and asthma trial at MGB right now, and many of the participants are getting health-related social needs boxes, which I know will just improve the outcomes of this clinical program and trial. So, and then if you want me to talk about the methodology, about the costs, I can talk about it, but I don't know how far you want me to go into that, O'Neill. That is
Thank you, Lauren. It's after lunch. We want to keep people
to get
focused.
people awake. Exactly.
Yeah.
But it's detailed in the report, and a nod to Children's Health Watch and Ana Poblacion, who really helped us make sure that this methodology was sound and very in line with work they had done for us before I joined GBFB.
So, Lauren, I wonder if you could speak a little bit to some of the comments that you opened up the talk with. Especially one of the things I'm struck by in the study is how modest our clients anticipate that their needs are or will be to be food secure. I'm curious if you could comment on what was shared with you and your fellow researchers, and also your own observations about that relatively modest need.
I think families do the best they can with what they have. So they will stretch their money, and they get very smart about food choices and purchasing. And so I think that $62 is coming from not wanting to take from other people, but also being really creative with how they use their resources. And so I see that as a pediatrician all the time, that they're stretching that food as much as they possibly can. So I think the $62 is actually very in line with what we saw last year too. So maybe a couple of dollars more in the inflation situation. So I think it is probably pretty accurate. And then the $628, I know the universal income, basic income is about $1,000 a month, but there are other projects that are launching in the state actually that are about $750 a month, and that's pretty in line with what people are estimating they need. We also have, if you look at that, the trade-offs of childcare is pretty low, which is interesting. I think there are some childcare vouchers. There's our the tuition trade-offs, which I didn't present today, those have also decreased with, college tuition initiatives covering college tuition in the state of Massachusetts for community colleges. I think there are a lot of things that Massachusetts does so that universal basic income is a bit lower than what we've seen nationally. And yeah.
Thank you. Catherine, I saw you unmuted a moment ago. Did you want to add something?
No, it's a fascinating and honest response about economics. We know the three things always exist around hunger, and it's economics, politics, and then personal situation. So when you think of the economics of having enough money to walk through the front door, to take care of your family, to buy the foods that are important to you, culturally or dietary, relevant, that is where we want to get to. And the expense of that, as noted in the study, I think was $7 billion. So there have been proven studies on this. So that there is data that says, yes, it helps families pull up and out of their circumstance. So it's a noble goal, but a very difficult one. So in the meantime, we have to make sure we have adequate food for them.
Thank you, Catherine. Lauren, the other finding was around social connectedness, and you had a slide on that. And I'm curious about what does that tell us about the impact of food insecurity on our communities?
I think it can make people feel very like their community is not looking out for them if they are struggling to find food for their family. And so I think that's probably what is happening. And so I think our food pantries that offer way more than just food, we should really focus on that and the social connection piece. So tomorrow, where we are having the event, MGH Revere has a teaching kitchen where their dietitian makes amazing food from the Greater Boston Food Bank food. And people come in and they have lunch there, and he does some kind of health coaching, and they all kind of have a meal while they're picking up their food. And you can see this community growing. And since it's only been open a couple of years, I've seen this kind of community space grow. And I think we really need communities to embrace each other and to gather and to come together. That will be the only real solution to this as well. And there's a lot of literature also to say that you cannot just meet a person's food needs. You also, at the same time, need to meet their social connectedness needs. So as an organization, I know we're doing that already, but I think lifting that will be really important.
Thank you. Catherine, any closing comments before I make a bit of a summary on next steps?
My closing thoughts are, here we are. We are in some of the worst times that we've ever seen around policy changes and implications of policy, and the cascade effect of a decision to a decision that causes a decision that causes a decision. And the person who needs the food is so far down in that cascade, which is what Lauren's talking about, is their ability to go find food, find fresh food, be greeted with dignity and respect when they come through. The piece is the data just assures us that there's work to be done. There's collaboration that has to continue, and hopefully will, among advocates and providers and philanthropists and government, and that we need to just join hands and step forward and do what we can step by step. It'll be a very trying time, but there's a lot of work to be done, and there's a lot of good work happening. So let's not lose sight of that. And there's going to be challenges. So hopefully we will be able to marshal through them. And I just want to thank again Lauren, her research team, the MGH folks and MGB folks, and the GBFB folks and our Health Council that just really embrace this as an important piece. Data doesn't lie. Data is pretty solid there. So let's embrace the data and do what we can on the policy side.
Thanks, Catherine, and thanks everyone for joining us Thank you, Lauren, for a great presentation and for the respective teams that helped to do this work over the last several months. I appreciate your thoughtful questions and observations. We would welcome more questions and observations on the study once it becomes public tomorrow. So please look out for the Boston Globe article online later this evening or in print tomorrow morning. We will be sending the article and the news release internally and as well externally with our with donors and volunteers and other stakeholders. And we would encourage you to amplify the story on your social networks and also to engage with each other, colleagues and advocates and others in conversations about the study itself. Thank you so much and have a great rest of your day.